Nice.
That does it!
Oh!
Canada!
Oh my gosh, that's definitely how majority of the patients I see that come to the emergency department with a broken hand due to punching something probably feel. Typically what ends up happening is a classic boxer's fracture, not an injury like Deadpool here, but you typically see a fracture of the metacarpal.
That's not good.
And you can see like his wrist is just floppy everywhere. You can get a wrist fracture with different types of trauma due to pushing your hand out to try to brace yourself versus coming across and hitting something.
Please.
Shot.
Oh!
Your poor wife.
Typically, we don't see bilateral hand fractures like that. You could, but then you get worried that outside of hitting somebody who's made of steel, why is somebody breaking their hands so easily? There's something called osteogenesis imperfecta.
Osteogenesis imperfecta.
Where somebody can get very easy fractures.
You really should stop.
All the dinosaurs feared the T-Rex.
Oh my gosh. You see just these two lumps like right here in the wrist. You know, could that be a depiction of the distal ends of your radius or your ulna? Could be, but you also have a ton of wrist bones as well as, again, all of the metacarpals. Oh!
I promise this gets worse for you, big boy.
Oh my gosh, look how badly displaced that ankle is. So you're snapping it. You're gonna have what's called a trimalleolar fracture. Fractures of 3 different areas of the ankle, also relating to ligament injuries, tendon injuries, and possibly a dislocation.
You ever hear of the one-legged man in the kicking contest?
Do you have off switch?
Yeah, it's right next to the prostate. Or is that the on switch?
Enough.
Oh. Talk about like the idea of like spidering the windshield. You worry about obviously some whiplash injury. Ends up most of the time with cervical strain of the muscles of the neck. Definitely if you're having any pain to a specific area of a bone, it needs to have imaging to make sure you don't have fractures.
You ever see 127 Hours?
Oh my gosh, so a movie referencing 127 Hours is where the individual gets their arm stuck in a crevice and ends up having to cut off his own arm. Oh my gosh. I can tell you, for one, because I've done amputations before, cutting through all that tissue is not easy. Yes, it is messy. We do it very systematically where when you cut through the tissue, anytime you see a small blood vessel, it's going to get cauterized. If you see a little bit bigger blood vessel, you actually need to tie it off before you cut it.
Are you there, God? It's me, Margaret.
Oh! When it comes to cutting the bone, you use a saw to cut it. You wouldn't necessarily cut it straight across because you need tissue to be wrapping around the end of the bone, otherwise you have exposed bone.
I'm gonna rip you in half now.
That is such a juggernaut thing to say.
Oh! Oh! Juggernaut. I remember as a kid, I used to have a Juggernaut like action figure.
Juggernaut!
Ripping a human in half. Obviously, we know this is very far-fetched. We just see a ton of blood pouring out. You're ripping through the major blood vessels that run through the pelvis abdomen there, which would include the inferior vena cava as well as the abdominal aorta.
Oh my God, I can't feel my legs. I can't feel. Oh no, they're right here.
Could he potentially feel his legs? Maybe, may be able to feel the pain, or he might feel obviously nothing. Most of the time in the acute injury, you feel nothing, which is very, very scary. But then later, after the damage is set, the swelling is gone, sometimes people can have phantom limb syndrome.
Maximum effort.
Oh, yes.
Yes.
Normal person, not Deadpool, that would cause significant injury, breaking through glass, but you're still causing trauma to your feet and your spinal column. Oh, massive road rash, eating away the tissue. A lot of times what ends up happening, you get deeper than the blood vessels, and you're gonna need a skin graft to have this area repaired. Ooh, a lighter. Oh, anybody's car still have one of these lighters? I don't think mine does anymore. Burn the guy's forehead. Hopefully that burn doesn't go all the way through. That needs to have repair to where you have to have a skin graft on your forehead. Typically deep 2nd degree burns and 3rd degree burns will require that. Shot through the right forearm and all the way through and through. If the bone is injured, it needs to be taken to the operating room and washed out. You would get significant concern for osteomyelitis, which is the infection of the bone. Oh, posterior, the exit wounds through the skulls have a significant amount more of trauma, and that just has to do with the force as it's going through and the energy that it takes with it. One bullet versus like 50 just depends on the areas that you're getting hit. Oh, well, you guys know weapon in the body. What do? Of course, you do not pull it out. This also reminds me, for you, my Dr. ER audience, I have a special discount code for my Life Happens supplements. Don't pull it out, 30. Oh, flying into a metal post like that. Most people will end up getting soft tissue injury. A big bruise, ecchymosis.
Ecchymosis.
Basically meaning pop blood vessels underneath the tissue, typically purple, blue, and then over time will turn like a greenish yellow. You definitely want to double check and make sure that there's no fractures. Ow. Is that knife in his head? Oh my gosh. Holy crap. Does this happen? Rarely. I've seen many people come in with the attempt of a knife to their head. Typically the skull is resilient enough that it bounces off, as well as spherical, so it's hard to actually have that point go in. Oh! When somebody falls like this, gets caught, you worry about whiplash injury.
I think I got whiplash.
Spinal cord injuries because of being pulled, as well as any groin discomforts because the parachute gets caught and pulls up on the groin.
Stage left, you idiot!
Oh my gosh. Typically, our blood as human beings is red. Despite what people say out there in the universe where they say our blood is blue, it is not blue. It might look blue through the skin, but no, it has nothing to do with when the blood hits oxygen. Does it change color because there's oxygen in your blood? So no, the blood is red.
Vanisher.
Maybe the wind
Oh my gosh. Somebody gets electrocuted, you basically check, for pulses, look, listen, feel, start CPR, get an AED, an external automated defibrillator, get the individual to the hospital.
X-Force! X-Force.
Oh no, I know what's gonna happen. Oh no. Typically the injury that we see relating to heavy machinery is a hand, usually, or a limb getting stuck at work or something and it gets tore off. Most of the time you can't reattach it and it's just an amputation at that point, unfortunately.
Peter.
We're X-Force.
Whoa. Oh my gosh. What the heck? There are some chemicals out there that can definitely get on your tissue and cause significant amount of trauma or injury. Typically, if anybody comes in with like a chemical exposure, we need to know what the chemical is, and then we'll actually call poison control ourselves. In the United States, it's 1-800-222-1222. Oh man. Nice. Okay, super cool. The ribs. It's really interesting anatomically. We feel in our bodies that the rib goes completely all the way around. The rib is actually only the size of your hand, so to speak, when you actually do this. So it's actually quite accurate. Taking a piece of metal right to the face, to the head, that could have went through the skull versus the eye. A lot of times if there's that much destruction to the eye, it can't be saved. If it goes through the front part of your skull, that's your frontal lobe. It has to do with higher level of cognitive thinking as well as personality. Wow. The bone that went through the skull is actually the humerus, lower part of the elbow. So the elbow is made up of the humerus and then the radius and the ulna. And then, oh my gosh, you have all the bones of the spinal column as well as the skull attached. That's basically what we would call your central nervous system. What bone was that? Anybody? Anybody? That was the femur, right? Because you have the top of the ball in the socket. Actually, the most common areas that we see fractures on the femur is where he's holding it in his hand. You have the ball component, but then there's a neck.
Look at that neck!
The neck fractures often, or something called an intertrochanteric fracture, which are the other two nubs. Taking the skull and hitting somebody else's skull, we're seeing a bunch of the red stuff. Does it happen that way? I mean, it could potentially, but you wouldn't see that much through like a helmet. Most of the time it will start seeping at that point. Oh man, he's got Wolverine's claws. Oh, hit to the right side of the head going through impaled objects. Could that happen? Yes, because they're sharp, easier to get through. Likely that it is a non-survivable injury. All the main important structures of your brain are centrally located and deep within. Oh, injury to the right shoulder.
Right shoulder.
Dislocations are probably the more common injury to the shoulder that we see versus a rotator cuff injury. Most of the time we get an x-ray first of the shoulder to see if there's any fracture. Oh, I don't think that person's going to the bathroom well anytime soon. Or that one. Impaled objects to the rectum.
Your rectum.
Can severely injure the rectum, your descending colon. That needs to be evaluated by a general surgeon. Typically, somebody will get a CT scan. At least in that scenario, the objects are not pulled out. As I've always said, don't pull it out, just leave it in, get to the hospital. You can leave the objects there actually as you get the CT scan because it's not magnetized.
Magnets, how do they work?
Oh my gosh. You wouldn't want that type of metal in an MRI. Don't know if adamantium would react to the MRI as a magnet, but I wouldn't want to try to figure this out.
Get my country's name out of your mouth.
Oh my gosh, that is really funny. Blade to the face, impaled object into somebody's skull. Depends if it's lower versus higher, and depends what path it took in the sense of, is it midline? Did it miss everything because it went perfectly midline between the two hemispheres? Or did it hit every structure along the way?
Give me a hand up. Nope, I'm actually okay, thank you.
Impaled objects into the lungs through the ribs, rib fractures, as well as a hemothorax or a pneumothorax. Hemothorax, blood in a space around the lungs. A pneumothorax, air around the space. Oh! Groin shot.
My groin!
Fractures of the pelvis. The pelvic bones actually bleed a lot, and you can bleed a lot into the pelvic basin. If somebody has like an open book fracture to the pelvis, basically the pelvis opens, well, you actually do a binder of the pelvis. There's kits that they have, or you can just wrap a sheet, tie it, and then tie it super tight, and it brings it all back together.
You should be thanking me for pulling you out of that bed you in.
Oh! We don't have Wolverine or Deadpool's restorative healing powers, but did you know that during sleep, your own body heals tissues, rebuilds muscles, and releases growth hormones? If you want to improve your sleep quality, try Do Not Disturb by my company Life Happens. It's available on Amazon as well as lifehappens.com. Oh, gunshot wounds to the flanks on each side. You have the liver on the one side, spleen on the other. Both organs are solid organs, but they're very vascular and they will bleed a lot. The misconception of bullets in TV, film, we take bullets out of the body and that saves people. No, bullets are very rarely removed out of the body because of the problem of getting them out. You cause more destruction typically.
I just need your help.
I don't care.
If the bullet is in the brain, spinal cord, or in a joint, that's typically removed or attempted to be removed. But outside of that, usually the bullets stay. People always ask about lead poisoning. Could that be a thing? Yes. Once you're stabilized and things have improved, then you could potentially have a surgeon go in and get the metal out. Right where Wolverine's left hand is, Deadpool's right upper chest. You might be hitting the clavicle depending on how low or high it is. What sits right underneath the clavicle are major blood vessels right off the aorta. Subclavian vein is one of them. Oh, laceration to the back, causing superficial laceration, just painful. Say we repair that with lots of sutures or staples or multiple layer closures. It's gonna hurt like heck every time you try to bend over. Oh, obviously we can't see that, but it's a lateral aspect of the left neck hitting the jugular vein or the carotid artery, or it might actually hit the external jugular vein. That's the one you see when you squeeze really, really hard and you have it pop out of your neck. As long as he doesn't have dextrocardia or situs inversus, where the heart goes to the right, you're only going to hit lung tissue, probably hit the right middle lobe. Oh.
Grow your head back.
Question for all the Deadpool fans out there. If his head were to be amputated, would he be able to grow it back? Let me know in the comments. I'm not sure. I'm asking for a friend.
You're not gonna love what happens next.
Oh my god. Oh my god. Oh my god, he's gonna say it. Ah. Oh my god, he's gonna say it! Hey,
Oh my god, I love it, I love it. Who's a fan of Captain America?
I can do this all day.
Avengers! Flame on! Sorry, what?
I love it. In general, if somebody has that amount of fire on them, first degree burns happens in like a very few seconds. Then you're gonna start just burning into the skin. Second, third, and fourth degree burns. That amount of flame would probably lead to third and fourth degree burns. Oh, they did such a good job. Obviously, we always worry about the huevos, right? The balls. But me, that amount of fall, I worry about the pelvic fracture. So you land right on the pubic symphysis area. You can fracture the pelvis. You can also land on your coccyx and the sacrum in the back, lower part of your spine, which also can be fractured. Oh. Done. Okay. Hyperextension of the neck causing a cervical fracture in the back, and then lands in the classic scorpion injury, super hyperextended all aspects of his spine. Your thorax, so the upper part of your back, is not made to go in that significant direction.
I'm gonna fight you now. Oh, are you?
Oof. Oh, nice. Classic that your nose starts bleeding because sensitive tissue in there. How do you get the blood to stop? You need to pinch your nose and lean forward. Don't lean back because it may not stop the bleeding because it might be deeper, and then it's just going to trickle to the back of your throat. When you swallow the blood, if you swallow too much, it can lead to nausea and then ultimately vomiting. Oh, the epigastric area, the abdomen. Wolverine put his blades right into the abdomen and is twisting.
Twist it.
Ripping through the tissue a little bit more, making the holes bigger inside. You have your stomach, you have your pancreas, you have your transverse colon, blood vessels in the back, inferior vena cava, potentially going to the liver. Airbags cause injuries. It's explosive reaction. We'll see people that get head injuries, neck injuries relating to it, but the alternative is that it doesn't save you from ultimate death relating to a really bad car accident. No. Oh, massive hyperextension injury at the elbow. The olecranon is snapping off your elbow, the point. Oh, there you go. He's able to fix it. No problem. Typically, if somebody did come in the emergency department with that, we will try to splint it back in an appropriate anatomical position because we want appropriate nerve and vascular flow.
Uzi time, baby.
Uzi time, baby.
Look alive! I think I'm hit.
Oh my gosh. Hit multiple times. Remember I've discussed bleeding from the mouth? Well, in this circumstance, it's a high possibility. So that much trauma to the lungs, if it causes you to cough, you can actually get blood within the airway. Or if it hits your esophagus or neck, you can have some blood contents come up as well.
Listen to me, gorgeous. How long does it take for you to regenerate? Regenerate? How was I supposed to know he doesn't regenerate? I'm not a medicine woman.
That individual needs an emergent thoracostomy, so a chest tube, and most likely will need to be intubated to protect the airway. The degree of injuries will continue to potentially get worse as time goes on, and you want to control the airway.
Look, a donut cart. They're practically hospitals. They sell portable triage units.
Can confirm that a mobile donut stand does not have medical equipment. Maybe a Band-Aid.
What are your legs on vacation? You're dead weight. It's because I'm paralyzed. We all have problems.
Okay, so he's paralyzed. Somewhere along the line, got a spinal cord injury from one of those bullets. Even if a bullet doesn't hit the spinal cord, but near it, the amount of swelling could actually give the same symptoms of being paralyzed. As that swelling goes down, you're able to regain the ability to either move or have sensation back.
Listen to me. You're gonna live. Say it louder! I'm gonna live.
Wow, very much depicted like Resident Evil, just a bunch of fluid. Typically you'd see a lot more bone fragments in this scenario, but again, could it all disappear? Sure. Nice. Yeah. First off, super cool. It is Ryan Reynolds. I think this is Wade Wilson. For everybody out there who knows more than me, please let me know. Oh, man, stab wound right to the flank. Classic marks, open wound, really clean. Did a good job depicting it here. You're hitting it below the ribs. You're hitting mostly probably your colon, maybe some of the vessels coming down, as well as maybe your ureter, which comes down from the kidney down to your bladder. What? I wish I had the technology to be able to heal wounds like this. Typically, if you came into the emergency department and I needed to fix you, obviously we're going to do some imaging first to make sure that there is nothing injured on the inside. If it's just a superficial wound, a couple sutures to close that up. Whoa, super cool. What are we looking at? Really cool anatomy, right? We've seen the heart beating, we see the lungs underneath the rib cage, and they did such a good job of showing that the rib cage does not go all the way to the sternum, because as those ribs stop, that's where cartilage takes into effect, and the cartilage fills that space.
I saw you down in the room like this with your heart
Just
in your
can't
hand.
leave her with those freaks and killers, Uke. I'm the only chance she's got. Not with that thing inside me.
You're going to die, Logan.
Maybe that's okay.
Oh
No,
my
listen to me,
gosh.
Logan.
Interestingly, he's going from a subxiphoid angle. There are procedures that we need to do in the emergency department where we need to stick needles into the pericardial sac. We do a subxiphoid approach angled up towards your left shoulder.
No, stop! Logan!
You're not gonna want to watch this part.
No, listen to me, please, no!
Okay, so you got to be really careful, because if you're using your hand, which sometimes we do when we do thoracotomies and we open somebody's chest open, you got to make sure that you're not going to slice your hand on any of the ribs, because those ribs are super sharp. And it's super cool because you see his fingers, and his fingers are phalanx is what we call them. See that like image? It's actually very similar to the C-arms that we use in the hospital, where you do basically continuous x-rays. Stop it. That's crazy cool. I would be like crushing that in my hand if that was me. Oh, now is he going into cardiac arrest? Oh, asystole, flatline. Not a good rhythm. Why is that not a good rhythm? It's not a shockable rhythm. You cannot use those defibrillator pads to shock somebody out of asystole.
Today, you're going to witness medical history.
Oh, Stryker.
To begin bonding adamantium.
Adamantium.
Skeleton.
Oh my gosh, super cool. Logan, Wolverine here, was able to use his bones before as his claws. Where these bones in the forearm, are they his ulna and radius? It could be his metacarpals, but we have 4 of those. Blood pressure on the bottom, 120/65. That's pretty calm for somebody like chilling about to go underwater and be stabbed with some needles. And then same with the heart rate of 62. Oh, now they'll see the change. There we go. So they're doing this to him, right? If anybody doesn't realize, they're injecting metal into his body to fuse with his skeleton so he can be that much awesomer.
That's why you have to volunteer.
Heart rate 190.
Heart rate 190. That's pretty darn good for somebody his age. There is a calculation of like maximum like heart rate based on, you know, your age.
Heart rate well beyond maximum.
Blood pressure.
260/180 and rising.
So it's really interesting. They're saying 260/180. When we see that, typically your heart rate's not that high. Usually they go opposite each other. Now, yes, could it happen to a point because due to a significant amount of pain, the pressure's that high? Yes, but also blood pressures can be falsely elevated if you're contracting against the blood pressure cuff that is on your arm.
You broke the machine.
Heart rate over 300? Yeah. Have I ever seen an individual with a heart rate over 300? I have not. We do see the radius and the ulna, but then he has these 3 other bones, which we do not have. We don't have Logan's restorative healing powers, but did you know during deep sleep, your own body heals tissues, rebuilds muscles? So if you want to improve sleep, try Do Not Disturb on lifehappens.com and on Amazon. Ooh. Oh, rebarb stab to the back. Are you kidding me? Obviously, I would tell you don't pull it out, but it's also connected to a massive piece of concrete. So this person, if it wasn't Wolverine, would be trapped underneath this with all that weight, and it actually might fall over and rip the innards out of you, so to speak. or this would happen. Oh my gosh. So we've actually had individuals come into the emergency department being impaled with rebarb, and typically we end up stabilizing it, making it shorter, so to speak, so we can actually get some imaging of it. We can't get an MRI because that means that metal's flying everywhere, but we can get a CT scan.
So much for being a survivor.
I feel like if he really wanted to hurt him, he would just expand all that metal really fast and rip him to shreds, but he doesn't. He throws them out. Oh my gosh. Maybe not able to breathe. He's going to drown. There are a couple things that we talk about when it comes to water. You can have your initial response where your vocal cords close up due to the shock of the water and can cause what's called dry drowning, so to speak. But then obviously you have your wet drowning where you actually get fluid into your lungs. Holy smokes, literally.
Literally?
A lot of these burns that you see on Wolverine are deep second and third degree burns. We don't see any fourth degree burns here because we don't see any significant subcutaneous tissue and into the muscles and bones. But we see all the skin, maybe some fat underneath, but he's able to heal really well. I wish our bodies could do that. That'd be amazing. You worry about airway first. If there was any indication that the flames got into somebody's airway, seeing soot in their mouth, singed nose hairs or face hairs, then you worry about, okay, is the airway going to swell because of the flames that were there and the inflammation? Oh, it's like Green Goblin's explosion. Yeah, it is. Explosion to your face.
In the face.
The biggest things we worry about, obviously, are injuries to your eye, injuries to your airway, injuries to your chest. There could be a rupture of your eardrums, could be hemothorax, basically a rupture of the lungs, so to speak. Wow. Okay. Flying through a brick wall, obviously bricks we know are really hard. As you fly through the wall, you kind of curl up, but your spinous processes are out for everybody to see. They're protective of your spinal cord, but they're the ones that are first hit. So the question ends up being, do you fracture those?
And you spat in my face.
Oh, takes a punch right to the chest. Sometimes when somebody goes into immediate cardiac arrest and we see it happen, you can do a precordial thump. You actually do a thump right to the chest to try to catch the heart as it's going into an abnormal rhythm to get it to shock it right in. How do you not break your hand? Classic boxer's fracture. Biggest thing you always worry about is breaking the metacarpal in the hand. The bone snaps and goes up in a peak like this. Oh, nice. Gets tossed with the uppercut. Uppercut to the jaw, the things that we always think about. Besides a fracture of the jaw, make sure your tongue is not in the way. I've actually seen tongues bitten off and they bleed so much. It's very difficult to try to sew that, especially when there's no other tissue to sew back together. Oh. Taking a lot of hits, and there's minimal amount of significant damage to actually his face. I wonder afterwards if he was a mere mortal, the amount of swelling that would actually go on. I've seen people come to the emergency department where their eyes are actually swollen shut from the amount of trauma that they've actually taken to the face. Oh, so a brick wall falling down on you would probably kill most people, if not significantly cause a lot of trauma. Unfortunately, we see these types of injuries in, like, say, earthquakes, different types of things that can cause a building to basically collapse. At least a little dazed. People get hit in the head. You get this dazed and confused kind of feeling where you're like, whoa. It's because you got your bell rung. It's the same if you just get punched in the head. It's just because everything gets shaken up, moves around in there. Getting hit in the abdomen. In the medical world, it's called your epigastric area, and it's multiple different quadrants that we actually refer to. If there's enough trauma to that epigastric area, you can cause pancreatitis, hematoma to your duodenum. You can cause different types of internal bleeding. So those are the things that we actually look for.
Godspeed, Spider-Man.
Oh, Spider-Man has a little bleeding to his face. You can see a small cut that is there. Sometimes the small cut that little will actually use a type of medical glue. Oh, Spidey sense knows. Oh. Impaled into the pelvis. Depending on where in the pelvis, it actually can bleed a significant amount. Because your aorta that goes down through the abdomen, it actually splits after your kidneys and goes down, headed towards each leg. The likelihood that blood will come out of your mouth that fast is unlikely. Blood coming out of your mouth either needs to come from your airway or it needs to come from your intestines via your stomach. Oh! Explosion right to his chest. We always worry about breaking ribs, injuring your lungs, injuring the heart. You can transect the aorta with a lot of trauma. You can cause the heart to be stunned so it doesn't beat. And then obviously you can cause a compressive force injury to the lungs where they collapse. Wow, cool. Some of these could be gunshot wounds or lasers. We haven't gotten to the realm where normal civilians are using lasers to injure each other. The only time we worry about like lasers are like those red laser pens that can injure somebody's eye if you actually try to shine it too much. Drone injuries could actually be a thing now, mostly from the propellers. We used to see a lot of injuries where people would have injuries and lacerations due to electrical flying airplanes with really big propellers. But now we have more access to these drones, and the same thing could happen if somebody's trying to catch their drone. They can actually hurt themselves and lacerate or amputate a finger. So far, no injuries, just more entertaining. Oh. Getting a gunshot wound to the left lower quadrant of your abdomen could hit your pelvis, could hit maybe part of your ribs in the back, just depends on where it goes through. And then obviously your intestines, your ureter, those are the main structures that are in that area. Spider-Man's got 3 lacerations to the right cheek with some bruising. The blood is already kind of dried. You clean them up, wash them out using normal saline. You can wash it just with your sink water, but just make sure you wash it well.
Dosage has been increased to 200 milligrams.
Very interesting. That type of mechanism is a intramuscular because it was so big and deep. Typically, those areas that you want to inject are your deltoid, aka your shoulder, maybe your glutes, your butt,
maybe just one glute,
and plus or minus maybe your thighs. Oh jeez.
Me again.
Whoa, look at those nails. That looks like Bond, my cat, when she's having a bad day. So we'll get people that come in with scratches and lacerations and injuries from animals. We always worry about the wound getting infected, but you have to think about the type of animal that inflicted the wound and how. Is it a bite? Is it nails? Bacterias that they harbor are different. Trying to get that footage.
You better bring me some pictures of Spider-Man!
Don't typically see too many lizard injuries. I do know that there are some venomous lizards out there in the world, or types of reptiles, so be careful. Oh, there goes some of the sand. I see people that come into the emergency department with sand in their eyes, sand or rocks and dirt and wounds from road rash. And those little buggers do wreak a lot of havoc, cause a lot of pain. Even just a small grain of sand in your eye can cause corneal abrasions. Half his head is gone. There's not even a brain there. Half your brain is gone. The likelihood of you functioning is pretty darn low. But people can survive with missing a lot of brain tissue, surprisingly. Oh, Spider-Man would definitely have just snapped his neck and had a high possible cervical injury and maybe a skull fracture. Nice, super cool. Soft tissue of the face just came right off, but it was just sand. In that area, you have some pretty important arteries and nerves, so it would hurt and bleed a lot.
Take him down.
Oh! Tasers are something that we end up seeing come to the emergency department more often than you think. You worry about electrical energy going to the heart and messing up your rhythm. Whoa. So I think this is the first time he has Venom actually doing things with his body. Does your body ever do something where you feel like you're not in control of it? Almost like something called the hypnic jerk, where right before you fall asleep, your body does like a big movement.
I'm so sorry about your friends.
We have individuals who have strokes. They actually don't believe their arm is actually on their body and they just like ignore it.
This is definitely not my hand.
Oh man, having a dumbbell thrown at you. You worry about concussion. If you're gonna get a CT scan of that head, dropping weights, throwing weights, they can break bones pretty easily. They can cause lacerations and even dislocations or rupture ligaments. Gotta be really careful.
Let's be careful out there.
You take a chair to the lateral aspect of your lower leg. You worry about something called the terrible triad. 3 different structures, your MCL, your medial meniscus, and your ACL. Not. Come on.
Come on!
These windows don't break that easy. At that height, if you actually landed on the ground, would be your demise, unfortunately. Again, breaking through the glass.
How did you do that? Apparently I have a parasite.
A parasite, by definition, is just a living organism that lives off of another living organism and doesn't really give benefit to the one. It just is a taker, so to speak. Cool. As your arms get pulled up like that, really hard to actually take really good deep breaths because it's hard to expand your chest wall. Oh!
Never wound what you can't kill.
Oh my gosh, just taking a metal pipe to the face. You'd probably be knocked out, laceration, a couple broken bones. Even that much of a torque to the head could cause a vertebral fracture or disruption of some of the ligaments of the neck itself.
Look at that neck!
Oh! Puncture to the right upper lung, hemothorax, pneumothorax, blood to the lung, air into the lung. The one on the left, kind of low enough. It could be into the heart itself or through the aorta. Oh, painful. The ribs themselves are what's like holding the structure together, and that's why it's easier to lift somebody like that. Oh! Okay, why is he not wearing his motorcycle helmet? For all of you out there, wear your motorcycle helmet as well as full gear. I don't care where you're riding. I don't care if you don't think it's cool. Of the injuries that we see, the people that wear the gear have minimal amount of injuries. Hopefully they're wearing their seatbelts. Typically, if you're wearing your seatbelts in a modern car, the airbags plus the seatbelts will actually significantly protect you.
Oh, that was pretty cool, actually. I'm not gonna lie.
Oh. All right, we got a leg that looks abnormal.
That's not normal.
Some people can have it bend in that position, but after an accident, we're thinking fracture versus dislocation of the left knee.
You have been a serious pain in the Eddie.
Well, you know, I aim to please.
If somebody has a dislocated knee, we do worry about the vascular compromise because it does take a significant amount of force if a knee is dislocated. Typically, we'll end up getting a CT angiogram of the lower extremity to make sure that the vessels are not injured.
Vessels.
Oh. Come on. Come on! That type of injury without Venom probably break a bunch of bones, maybe intracranial hemorrhage. If somebody comes into the emergency department with bleeding in the brain, basically you're trying to minimize how much bleeding is occurring by lowering the blood pressure, 30 degrees up in the bed, maybe 45 degrees.
You never asked yourself.
Oh!
That's bad journalism!
Super hard to tell where he's getting this mallet just smashing him in the leg, or is it the groin? You're not gonna get a massive amount of force, but you're gonna get enough and cause significant amount of pain. You can break a bone, but the femur is really hard to break. If you're hitting the knee, the patella can actually fracture. You can actually split it in half, or you can bust it into a couple pieces.
Bust it.
Reminds me of Godzilla.
Though it isn't.
Oh, man. Went literally through the skull, maybe through the eye. If that was a human being, there is always a chance that it goes through the frontal lobe, hitting an area that is not essential, so to speak, for life. In the frontal area, there is your area of speech, so that could be affected and you might not be able to speak again.
Let there be carnage.
Ow. Has anybody had a hand injury, a puncture wound to the hand? That hurts.
Well, it hurts.
Puncture wounds can break bones pretty easily in the hand. Your metacarpals, you have metatarsals on the feet, metacarpals in the hand. Those can fracture pretty easily. Injecting blue medication through microneedling pads. We're not seeing like IVs. There is one medication called methylene blue, which is blue.
Are you blue?
Somebody has hemoglobinemia. Methylene blue is the medication that we would use to help with that.
Stephen? Can you hear me?
Probably too late to go to the bathroom, right?
We'll proceed.
The signal for you to go to the bathroom is typically when your bladder fills up to about 400 mL, so milliliters.
I gotta pay.
We'll have individuals come into the emergency department where it's over a liter. Woo! Sometimes they can't get it out and we actually have to stick a Foley catheter in there. Wow, that's what I look like after a pump at the gym.
Sure, Jan.
Can the body actually handle this type of change in such a short period of time? And no, people will go for leg lengthening procedures. It takes time. You wouldn't be able to actually do this without significantly damaging the body.
Before we get started, does anyone want to get out?
Sometimes we say stuff like that before we get started. Anybody have any questions, concerns? Do you feel like you're gonna pass out or get wobbly? Please sit down. Kind of similar to what we do in the emergency department or medicine. Electricity going to the chest. It looks like one of those things my nephew has where it has a little bit of spark and energy and it doesn't hurt anything, versus defibrillator pads that we use at the hospital where there's high amount of energy, 200 joules. Oh, that would make me feel nauseous and want to vomit. And wouldn't you think that you're flying down to the ground, individuals be flying to the ceiling? Oh, we get worried when somebody falls from 3 times their own height. That was like 20 times his own height. People do come to the emergency department with falls from great heights and could be as simple as an ankle sprain, a tibial fracture, versus somebody succumbing to their injuries. So it's a huge range. A typical injury from that type of fall, you would not just get up and walk away from. As you get higher and higher and higher, increase the risk of, say you break some bones, coverable, but the injuries are the internal injuries, hitting your head, brain matter all over the place, intracranial bleeding, stunning the heart, puncturing the lungs, rupturing ventricles or atriums of the heart. Ow. So I think that's his buddy. Got lacerations to the face. Don't use staples on the face. We'll end up either using glue, steri strips, or suturing it closed.
You're my mission.
I mean, he's got a hard face. Taking that many hits with a prosthetic arm that's metal, you'd expect it to destroy the tissue, break the bones of the face. So when people are getting punched in the face, on a normal individual, you increase the risk of fracturing your own hand. We typically see fractures of the 4th or 5th metacarpal. At least we see a little bit of swelling around the right eye and the maxilla. If you do have a fracture relating to the sinus, to the inferior wall of your orbit, that means that the air in here can escape out. If somebody sneezes, coughs really hard, and they don't open their mouth, then stifle it, that air then goes into the soft tissue and swells up the face.
Where is she?
Ooh. Oh, man.
That thing does not obey the laws of physics at all.
Taking that amount of energy to your back, you're going to cause an issue to the spine, fracturing bones in that area, increase the risk of a spinous process fracture, which is what you feel when you touch your back. The transverse processes sit on the sides. Oh, same on the front side, getting hit like that, sternal fracture, rib fracture. It's right in the area where we do CPR, and just doing CPR because ribs to fracture, almost like the wishbone, right? Oh, this guy would not survive. You just took that either to the face or the neck, including your airway, break your hyoid bone, could cause so much swelling to your trachea, your airway. Oh. Oh. He's gonna take off his head with that. You would think, okay, this type of force, is it causing head separation from the body, or is this just causing massive amount of tissue destruction? We don't see it, but could this be a massive amount of head trauma, facial trauma, to the point where you're just destroying all the structures up here into the brain, versus are you destroying the neck and destroying the airway? That is awesome. I wish I could literally take a leap like that and jump to the 3rd or 4th story of a building. I didn't realize Captain America was able to metabolize or not be affected by any noxious gas. You always worry about like organophosphates, those type of gases, anthrax, powders in the air, mustard gas, different type of nerve agents. We do have some antidotes for some of these things versus not others. Oh, I always worry about falls like that where somebody falls on the back of the head. You get a whiplash injury, you can have cervical spine injury, coup counter coup, brain sloshing around front and back, as well as skull fracture on the back. And then a lot of times we end up seeing abrasion or laceration to the tissue that hits the ground in the back. Oh! Ouch. Explosive injury, you worry about ruptured eardrums or tympanic membranes. If that happens, you can get some bleeding, potentially gonna get decreased hearing as well as ringing in the ears, aka tinnitus. Most of the time it heals on its own. If they're so bad, you might have to have a tympanoplasty done, which is when you get a new eardrum. Holy cow. Just got thrown around like a rag doll. Watching this high stakes action reminds me that sometimes life's occasional stresses can hit just as hard. That's where Chillax by my company Life Happens comes into play to help ease racing thoughts and bring on those calm vibes. Check it out at lifehappens.com or on Amazon. Oh, posterior head injuries, hitting the back of your head. You still have the same mechanism on the inside, so there's not a ton of cushion around there, like say football helmet, but we still see individuals playing American football and getting bad concussions, head injuries. Unlikely a fracture because there's some padding there. Oi. He hit his energy source. What other devices do we have in a chest? Like if you don't have it, you could potentially die. Pacemakers or defibrillators, majority of the time, they're one and the same. And then there's something called an LVAD, which is a left ventricular assist device, like literally pumping for you. Oh, okay, wait a minute. If you're getting bricks and mortar and all these different types of hard objects hitting you, you're gonna have some internal injuries, internal bleeding, would always lead to fractured ribs because they're small, something easy that can break. So he's got a cut on his face. The face bleeds pretty easily, but also heals really well. You'd basically clean that off, push compression to the area, and as a doctor, you would think he would fix himself. I love how those like sparks are flying. Sometimes when somebody has a hand injury, you may not actually feel like the nerves in your hand. If something's hot or something cold, you won't be able to tell what's happening. A lot of people end up losing tissue or having bad infections because they can't feel the uncomfortability. Oh my gosh, it's like running on the worst treadmill. Oof. Right. I know it's a movie, but that was a fall of like 3 stories, 4 stories, and you're landing on another human being. You're definitely causing internal injuries to that other person. Oh, that sucks.
You don't know how to use that, do you?
Take a look at this guy's eyes. I've actually seen people come in, look like that. Eyes are sunken back in. Typically, it's people who are almost like cachectic, like emaciated, not eating a lot. Also, people who are dehydrated. Oh, he just broke glass and now it's flying everywhere. The worst part is when you get it into wounds, sometimes we'll have to leave them there, but it's like a splinter will eventually make its way to the surface. Nice. The only thing you really worry about with cloaks, capes is strangulation. In the emergency department, very rarely does a doctor end up wearing a tie because of the high risk of patients potentially coming after you and using your tie against you. Oh! Impale. The biggest things you worry about in that area are a puncture of your lung because your lung goes up that high. What do I always say? Leave it in, because if you pull that out, it could open up a floodgate for blood to be pouring. Oh, nice. Thank you, cape. Is it trying to heal himself? Oh, we're trying to get away. Nice.
Cardiac tamponade.
Oh, he's at the hospital. He's got cardiac tamponade. Cardiac tamponade is when you have blood pooling around the heart. So it actually starts compressing the heart down. Oh, he's out.
No, Steven.
Check for a pulse. So that was good. Shake the patient, double check to see if they're alive or not. Check for breathing, check for a pulse. If you don't have any of that, call for help, then start CPR. You don't really want people messing around, moving things just because it's going to throw you off and distract you. It's like professional golfers out there when they get pissed when somebody's moving in the background or they hear the noise. It just throws their focus off. Okay, actually shocked in the right places. Right upper, left flank-ish or below, because you want the energy to go between them. Oh my gosh, put those down. Get your fingers up the triggers.
You were right. There's a complete... I treated you so horribly.
Sometimes when people are on their deathbed or have a near-death experience, they're so grateful, very apologetic, much different look on life.
Affect the real world, but they can still kill us. This wasn't cleverness.
He always has the same injuries. Always right cheek, left forehead, or left eyebrow. You have to be really careful with injuries of the eyebrow because you have your lacrimal gland that sits lateral. So if you suture that and tighten it up too much, it can cause issue relating to your tears, so to speak. Oh my gosh, like, what would you do if your world was like flipping upside down? They just fell from a great height right into a bus and there's no bleeding, there's no facial fractures. Either they're really tough or this multiverse weird world doesn't have that many injuries.
That is hilarious.
And of course, Stan Lee. I like that he always made a cameo in all the movies. Oh my gosh, I'm just getting nauseous and sick looking at this as the worlds are twisting and turning and spinning all around. Oh! Knife wound. Most of the abdomen is a lot of intestines. If it goes through, you always run the risk of hitting the spinal cord in the back and hitting the bones. You need to go to the operating room immediately. Oh! At least she fell through the glass. Maybe took some of the impact, but you're definitely gonna cause some injuries. Oh. That's like the classic way of washing your hands. The reason why you actually hold your hand up is so all the fluid and the liquid actually drips off the elbow because that could potentially be contaminated. In the ER, we have a very similar situation where you have medical students and residents, but they're in the rooms with us. When we ask questions, it's actually called pimping. Basically, you're just calling on people to answer questions. It is medical terminology that we use at the hospital. It's called pimping.
What is it?
GSW.
GSW, gunshot wound.
Apnea failed the brainstem test and the apnea reflex test. I think I found the problem, Dr. Palmer.
Wow, the bullet is lodged in there. A lot of times you guys probably have heard me say we do not remove bullets, except in certain specific areas, which in this case, they're probably gonna try because it's probably at the brain stem causing issues.
It's impinging on the medulla. I needed a specialist. Nick diagnosed brain death. Something about that doesn't feel right to me.
Medulla is basically the medulla oblongata.
Medulla oblongata
Is involved in involuntary functions. Respirations, breathing, heart function, all of these things.
You need to get it prepped for suboccipital craniotomy.
Suboccipital craniotomy. Craniotomy is when you cut the skull open, and then suboccipital basically underneath the occipital bone.
Not gonna let you operate on a dead man.
What do you see?
A bullet?
A perfect bullet. It's been hardened. You harden a bullet by alloying lead with antimony.
Perfect bullet. So the bullet hasn't changed shape. Normally when you fire a bullet and it hits something, it actually breaks apart and then it causes a lot of destruction that way. It is now just breathing these particles into that open area. Should be wearing a mask and definitely some eyewear.
Thank you.
And that hair just dropping in the face, that wouldn't happen.
Can't do it freehand.
This is
Oh.
no time for showing off, Strange.
How about 10 minutes ago when you called the wrong time of death?
So in the emergency department, that happens every now and then. You'll actually pronounce somebody dead and then all of a sudden they come back to life. There's actually a phenomenon called the Lazarus syndrome.
Cranial nerves intact.
Did you say cranial nerve is intact? So not exactly sure which nerve he's talking about, but we have 12 cranial nerves. A nerve is this like stringy looking white thing, so it's good that he's identifying that they're intact. The thing that's actually sitting next to Dr. Strange on his left is a C-arm. It's an X-ray. You can actually do continuous X-rays. And if you actually look at Dr. Strange's neck, you actually see a lead apron. I definitely use those alligator forceps to take bugs out of ears, bugs out of noses. Typically, you don't want to use that type of tool if it's blind because you can puncture areas that you don't know what you're going through. Oh. First off, he's already got blood all over the shirt, stains, especially white, really a pain in the butt to get out. Also, he's got a lot of bruising around his eyes and face in different colors. It's in different phases of healing. We call it ecchymosis.
Ecchymosis.
It's so classic that people punch each other in the face, and all I hear or think about are broken bones on the hand because our hands have small bones. The metacarpals, they collapse pretty easily with a lot of direct force, especially to the skull. Headbutting on the individuals. Remember, you're also using your own skull. It increases the risk of you having a laceration, abrasion, hematoma, and possibly skull fracture or intracranial bleeding. All of those things could happen. Oh, what is that? Like a broom handle snapped in half and just went into the intra-abdominal cavity. What is there? Intestines, omentum. Depending on how you get it in there, it could either go to the inferior vena cava or its branches, and then it could also be at the bifurcation of where the aorta breaks off into the legs. Multiple stab wounds to the chest, abdomen. Both those are going to be evaluated for hemothorax and a pneumothorax. A lot of times if somebody's alive with deep puncture wounds like that, they're probably going to end up with bilateral chest tubes. Oh, man. Side of the head, through the ear, into the brain, into the temporal lobe of your brain, messing with the ear. The ear is super sensitive, has a lot of nerves there. Just think about when you accidentally touch your ear canal with a Q-tip. It hurts. Thing that we worry about when people punch somebody in the mouth is that the teeth are going to lacerate the hand. That laceration is open to the joint. You're going to get bacteria in, increasing the risk of a septic joint, which is really bad. Needs to go to the operating room, needs to be washed out. Oh, he's got a weapon in his hand. I know he does. Yep. Oh my gosh. Stab wound and laceration to the left side of the neck, hitting the carotid artery, the jugular vein. The individual passed out pretty fast. I hope everybody was tested for bloodborne pathogens because there's a lot of blood that got into his face, his mucous membranes, maybe even his mouth. I love The Punisher. If you guys are fans of The Punisher, let me know in the comments. I love that show.
Whoa, whoa, hey.
You got a bad attitude, friend.
Ooh. Ooh. Taking a bowling ball to the face, all I can think about is fractured nose, maybe a Lefort fracture of the face, so fractures of the maxilla, or losing some teeth or fracturing the mandible. Massive trauma, massive head injury, skull into the brain, into the face, causing airway compromise as well as crushing somebody's brain. Probably there's a lot of brain matter left out there. Oi. Oh, into the pad of the face. Oh, gosh. Sticking these horrible sharp objects into your fingers, the pads of your fingers. They're super sensitive. There's so many sensory nerves there, sending signals back to your brain. And then the other component is it's highly vascular, so they're going to bleed a lot. Hey, we got the Daredevil. Did he just bite him? He's biting the neck, which if you get deep enough, could you cause a major injury to the muscles of the neck? Maybe, but most of it's covered with large muscles like your sternocleidomastoid, so you'd have to bite through that. But again, could still cause a lot of pain and catch somebody off guard. Oh my God, the fingers.
You okay? I've been better.
Just pulling those out, there is an increased risk of fractures to the tuft ends of the distal phalanx. So these are your fingers, but we call them phalanx. There's 3 different pieces for the fingers here. Oh, that's not survivable. We don't see these type of injuries too often come to the emergency department, but we do see a lot of car accidents, and we do see people slam their hands in car doors. More simple things than massive trauma like this. Not all those hits. Oh my goodness. Somebody has anger issues. When somebody is knocked unconscious, you're still breathing. You can have shakes of the body. It could look like a seizure. And you can be out for minutes to hours. What is left? Oh. Lots of the red stuff there. Cervical fracture, skull fracture, airway compromise, and then the brain tissue just being gone. Oh, yeah. Oh. If a life feels like a non-stop fight scene or more chaotic or stressful than usual, Chillax by My Company has your back. An occasional stress support supplement. Grab it now at lifehappens.com or on Amazon. Oh. Probably got stabbed in the side. You can hit your kidney, you could puncture the lung. What would we do if somebody had that type of stab wound? Airway, breathing, circulation. Wanted to make sure you got a good airway, that you didn't puncture a lung, that you might have to put a chest tube in or put a breathing tube in for them. Hand at the wrist.
He's got no hand!
If your hand gets chopped off there, could you bleed out? You could. You have major blood vessels. You need to hold tight pressure to the area. You may even need to use a distal tourniquet. And make sure you pick it up and bring it with the patient. You never know if there's a potential for it to be reattached. Oh. Oh, geez. Interestingly enough, we use a drill in the emergency department, certain situations where we can't get an IV, and we actually drill into the bone to get an IV. It's called an interosseous line. It's not intravenous, it's interosseous, so an IO. Ow, that is awful. All I think about is how dirty that wound is. You're drilling in the tissue, the shoelaces, the materials, which increase the risk of different infections. The foam in the bottom of the shoe can harbor something called Pseudomonas. That can actually get inoculated to the tissue. So when people step on a nail going the other direction and it punctures into the foot, you're worried about this type of bacteria causing an infection.